welcome back. It is time now for some 8-1 for your health. Join with us now. We've got Dr. Chris Perron back again. Welcome to the show.
Glad to be here again.
Yes,
how are you, Morgan?
Doing well.
Good, good.
I always love, picking your brain, kind of racking your brain on some of the different things that you focus on. Of course, living a healthier, better lifestyle to help us live a little extra longer. We all like the thought of that.
I like that thought.
Right?
Yes. We got to make things easier, right? There's so much noise out there, and I just try to attempt to bring some clarity so you can actually use some of that information that's out there.
Yeah, we were chatting too again about your approach to health. Obviously, sometimes people are out for the next quick fix and they're on a pill and off you go. You, though, are approaching things from a little bit of a different aspect, especially when we're looking at the world of chiropractic care.
Sure. Well, I am a chiropractor by degree, so that is my primary specialty. It does help. It does help. Like you said, we're always looking for the next quick fix. You also find a lot of people that are looking for that next quick fix are then looking for the next quick fix, and then the next quick fix, and the next quick fix. My goal is, how about we get off the hamster wheel and we just get back to basics by targeting a few basic things, simple things. Obviously, I wrote the book for a reason, but when you really target some of the basics and get out of the excitement of the moment and the fads, you can actually achieve it to where you're not looking for your next quick fix because you're just living and having fun.
I like that. What do you suggest, at least with the approach? Because some people get so hung up on, well, I can't do that. I'm not ready for that. I don't have time for that. That's a challenge. It
is a challenge. The biggest thing and the truth is that if we don't make time for our health is going to make us make time, right? And it's going to take more time, it's going to cost more money, you're not going to enjoy the ride, and so on. And chiropractic specifically is one of the most misunderstood things. I call it like the biggest secret in healthcare.
Yeah.
But there's so much benefit to be had by so many, but again, lots of noise, and how do we get some clarity on it? So that's obviously the primary point of being here today, is to hopefully give a little clarity to chiropractic specifically. And one of the biggest things is that everybody knows, you've seen on TV, you've seen it everywhere, like TikTok videos. I wouldn't go to the TikTok video, people, but it's but that's what we see, and therefore that's what we equate, right? And one of the biggest things is there are actually options. Exactly, it looks a little scary.
Medieval device.
Exactly, but it's there are options in chiropractic that are super effective. Like this is called an activator, and it goes with a technique activator methods that's been around for 60 years, so it's not like the latest craze. It's one of the most proven, and there's actually no twisting and cracking involved. All chiropractors were looking for the same thing, is to figure out where your joints are stuck, and therefore your body's not working well, whether it's on your nerves or your knee or your hip, and then put them back where they're supposed to be so that you can go on your way and your body's working right again.
Yeah.
It seems pretty simple. So whether I take my hands and feel around and go, oh, there it is, and push it back in place, or I take this guy and I can put it right on the spot I want, the exact angle. It's a measured force. And let me know what you think that feels like. Does that feel about as hard as me just tapping you with my finger?
Yeah, it's not much at all.
Exactly, and the patients hop off, they're like, that's it? And the reason that the activator works is it's pushing 300 times faster than somebody's hands can push. So you picture like a carpenter with an air hammer, they hit a trigger and somehow the nail goes through all this stuff, and they barely did anything. Seemingly, but mechanical forces versus a hammer.
Yeah.
All right, so it's super effective as far as that one, and that's one of the biggest things. So if people are afraid of the crack, which we hear a lot, and we get it, although chiropractic's safe in general, there is an option you can explore so you can get the benefit while avoiding, that hazard that you are seeing.
That's pretty amazing, too, especially when we're looking at chronic pain and these issues with your alignment, and, you can do simple manipulations to really help alleviate that.
We fix so many things. One of the other things on safety is people ask, and I say, you know what, who doesn't care about hype and chatter and all that is insurance companies. So I always bring up that my malpractice insurance is $1,400 a year for $3 million worth of coverage, which is the maximum you can get. Your GP is in the 10 to 20 range, OBGYN's like 100, right? So when we put into risk categories, it's like, it's super safe, and I don't get a discount for doing activator. So that's adjusting the traditional way as well. So chiropractic is super safe. The other one is that, healthcare is a team sport. Chiropractors, we're actually trained as primary care physicians. That's why we're doctors. It's actually a legal term. And we're like a blend between an orthopedist and a neurologist. That's where the focus of our training really is. And the big difference between med school and chiropractic school is really just how do we approach the same exact problem. So you take physical pain, for instance, as an easy one, a common, and yes, very effective. And you approach it with, well, here's a prescription, or here's some physical therapy. You know, you got to do what you got to do.
Yeah.
It's all well intended. This is, why don't we get to the actual cause of the problem and get you fixed up, and then the pain goes away? Because pain is just your body telling you something's wrong, can you help me? But the pain isn't the problem, it's the messenger. So we go after everything in chiropractic is about the cause and trying to get the cause fixed up.
Yeah, and it's things you do in your everyday life. Your driving, your posture, how you're sleeping. All of that plays into this.
Those are the big ones. Everybody thinks about, I picked up a refrigerator. It's almost never that.
Yeah.
It's always posture and driving and going to work and things of that nature. And the thing is, there's a guy, I don't know if you've heard of him, he plays for the Steelers. Have you heard of that team? Aaron Rodgers. So his dad is actually a chiropractor, and he's one of many pro athletes that advocates for chiropractic. And look at the longevity. You know, Tom Brady, I know that's not a good word around here, but it's but proof's in the pudding, Serena Williams, and they all have something in common. They're all about getting optimized function out of their body and longevity. So if it works for them, maybe we might want to tap into what those guys are doing, because it's readily available to all of us.
The proof is in the pudding.
Yes, ma'am.
Yeah, I'm on board, and I just appreciate you stopping by for, you know, educating our viewers, telling us what you're about, and of course, if people want to pick up your book, all about healthy living.
Absolutely. So Simple Plan, it is on Amazon, of course. And for more quick tips, again, I try to simplify things at chrisperron.com. We have tons of things in there and segments on different subjects. You just figure out what you're curious about and what you're looking for answers on. And most likely we have one there. Or you let me know what it is, and I'm happy to provide that info.
We love that. Thank you.
My pleasure.
All right.